So you cannot use your spacebar to unmute yourself and to control your PowerPoint. So let me try again.
Kanetta, I think you can use the arrows to move your PowerPoint. The arrow key.
Use the arrow keys, yep.
All right, so y'all can see the PowerPoint now, correct?
Yeah.
All right, so today we're going to be talking about healthy relationships, sexuality, and development. And as stated, my name is Dr. Kanetta McFarland, and today's talk will be putting together some of my areas of expertise, which is diagnostic assessment, working with children in terms of their gender identity, and then also advocacy. So my objective today is to increase your understanding of neurodevelopmental disorders, to review what does typical gender development look like in children, and then also discuss adaptations to sexual education based off of a child's development. So in terms of neurodevelopmental disorders, what does that even mean? So brain. So neurodevelopmental disorders are disorders where a child has some type of difference in terms of the structures of their brain or their central nervous system, which is your brain and your spinal cord. So everything that's listed as a neurodevelopmental disorder is a disorder that would start in the developmental period. And so therefore, because it starts in that early developmental period, we should be able to see these symptoms in early childhood. So somebody who is very hyperactive in early childhood, we would look at that and say, okay, maybe that hyperactivity could be associated with ADHD. However, if you just started to become hyperactive in your 20s, we wouldn't think that you have a neurodevelopmental disorder because these are things that start during that developmental period. And in terms of these disorders, it affects the way a child functions in terms of their social, academic, personal, and occupational functioning. And then for children, occupational functioning is how are they doing in terms of at school, how are they doing when they're in the community, and then for them, occupation is work in terms of how are they in terms of that young adulthood, how are they faring at work. Then in terms of neurodevelopmental disorders, they frequently co-occur with other disorders. And when we're looking at their symptoms, we're looking at things in excess. So they're doing things more than what's typical, or then delays in terms of typical milestones that we would think that a child should reach based off of their age. So the first neurodevelopmental disorder was covered a couple of weeks ago by Dr. Gentili, and that was intellectual disabilities. And so that's where a child has difficulty in terms of with their problem solving, planning, judgment learning, learning from experiences, abstract thinking. So that's being able to sometimes being able to identify gender is part of abstract thinking. There's parts of gender in terms of body parts, but what does it mean to be a female? What does that mean to be a male? That's part of abstract thinking. And then adaptive functioning. So how well are you doing at those everyday daily life skills? Then in terms of communication disorders, we're looking at language disorders. So how well do you understand what others are saying to you? How well do you express yourself to others? Speech sound disorders, do you have difficulty in terms of the frequency of your speech, how loud your speech is? Do you have difficulties in terms of communicating in social situations with others? And then also, do you have problems with stuttering? In terms of autism spectrum disorders, when we're talking about autism spectrum disorders, people previously diagnosed, they would have fallen into the category of PDD, progressive developmental disorder, or Asperger's. So those diagnoses are now all understood to be under autism spectrum disorders. It's understood that children with social communication difficulties, social interaction difficulties, and these restrictive and repetitive behaviors, that these are a spectrum of behaviors, and that when you see one child with autism, you've seen one child with autism. And so one child may be good in terms of communicating in terms of their words, but have a lot of difficulty in terms of in a social situation using their words. one child may have repetitive behaviors in terms of hand flapping versus another kid's repetitive behaviors is talking about a subject. So those are the types of behaviors in terms of when we see autism spectrum disorder. All right. The next neurodevelopmental disorders are ADHD, or what was previously called ADD. So ADHD, we have three different types. We have the inattentive type, which is more of the kid who has difficulty focusing and paying attention. They're more known as the stereotypical space cadet, versus the kid with the hyperactive type. Those are the kids that bodies often moving, hard to chill out and settle down. Most children, however, have combined type, where they have features of the inattentive and they also have features of the hyperactive. And overall, what we see in ADHD is difficulties in executive functioning skills. And that is your ability to stop and start things, to be able to shift from one thing to another, to be able to control your emotions, your working memory. So your working memory is your memory that you need to complete something now, not necessarily like long-term memory. And then your ability to plan, organize, and to monitor your own behavior. The next class of neurodevelopmental disorders are motor disorders. So children who have difficulty with coordination of their body, children who do a lot of stereotype movements. So an example of stereotype moving is repetitive body movement. So hand flapping would be an example of a stereotype movement. And then tic disorders are those repetitive behaviors. And the tic disorder that most people are familiar with is Tourette's disease. And then the last group of neurodevelopmental disorders are the specific learning disabilities. And so those are disabilities in terms of a child's ability to be able to read, write, or to be able to do mathematics. So now we have this information in terms of these are all these early childhood developmental changes that a child could be having some level of difficulties. So now I want to look at what does like typical gender development look like. So by the time a child is 2 to 3 years old, they can identify their own gender and are starting to use pronouns to identify their own gender. So they're identifying most likely he or she. We're not really hearing they out of children. And also, kids can identify toys by gender. And they also tend to seek out same gender role models. By the age of 3 to 4, they're aware of their gendered anatomy. By 4 to 6, they're starting to use gender scripts and constructs. So that's like belief systems in terms of boys do this versus girls do that. And understanding that this is kind of like what's supposed to happen based off of the information they're picking up from their environment. Now, prior to the ages of 6 to 7, gender is not stable. Gender is more something that is connected to the activity that you're doing. So if in my house, dad does all the cooking, boys do cooking. So if I'm cooking, I'm a boy. Versus if girls like dresses and I'm wearing a dress, now I'm a girl. And so gender can still be very fluid, but by the time the child gets to 6 or 7, they understand that it's not just associated with an activity. Then the next area that we start to look at gender is in terms of the ages of 9 to 12. Your identity starts to stabilize even more. And then we have the beginning of puberty. Then through adolescence, we have hormonal changes, and then we have the social anxiety, and we have dating. So in terms of thinking about gender information, and then also children in terms of that have like some type of intellectual or developmental disabilities, how do we deal with like sexualized like education for these kids? Well, research indicates that this education should happen in school. And one of the things that made me think about this is when we talk about IEPs here and functional academics, and what does that mean and how is that a part of somebody's programming. So a functional academics is a part of a programming that really focuses on the instruction to teach skills to a child and to help them to be able to perform like their daily routines. And what level that is or what we're actually teaching is really based on the developmental level of a child. So in terms of sexual education, Ohio is a state that doesn't have any health or sexual health education standards. It's up to each school district to develop their own health curriculum, and that health curriculum does not have to include sexualized education. By law, that health education curriculum has to contain information that stresses abstinence and that also stresses the negative consequences of sex. So that includes STIs, so sexually transmitted infections. In terms of sex also leads to children, and then also the financial responsibilities that are associated with sex. However, this health curriculum does not have to be medically accurate, culturally competent, unbiased, or gender informative. So in terms of our advocacy, one of the things that we may see us needing to do is to actually add in sexual education into the IEPs of some of the children that we're working on. And when people think about sexual education, again, we're dealing with children with like a range of skills. And so we need to think about what does that look like? So for some kids, that'll be teaching about bodies, reproduction, and risk reduction. All of those things we could teach to all kids depending on where their development. So with one kid, I may be working with a picture board and we may be using a picture board to identify bodies versus with another kid, we are talking about what is the function of this body part and how does that work? In terms of risk reduction, that is in terms of, that could be education about when is it safe to use a bathroom? What do you do when you're alone in certain situations? So I gave lots of different examples here in terms of touches, public versus private, in terms of working with children who have difficulties in communication or difficulties with eye contact. How do you have these kinds of conversations? When I'm working with a child who has autism and they have difficulty with actually doing eye contact, well, then I would have the conversation where we're doing a side by side. If I have a child who has difficulty in terms of regulating their body, we're going to be side by side and maybe walking or doing something else. What ifs are very important things that we need to teach kids. So what happens if your period starts during the day? In terms of the developmental level, for one child that may just be identifying for the teacher that something is happening versus for another kid that's being able to be aware of the products that they need to use to help them deal with that. In terms of another one that's very common is in terms of erections. If you're working with children, that may not be something that they know how to deal with. So going through and teaching them what are the things, that would be like your daily skills that you need to know to deal with that. And all of these things overall lead to children being able to have healthy relationships. So often when we think about sexual education, we jump right to sex, but a lot of sexual education is about being able to create healthy relationships. And so in terms of us, one of the things that we need to be aware of is that this is not necessarily being taught in school, and being aware of this and being aware that we may need to advocate for this in terms of the children and the systems that we're working with. Thank you.
That was fantastic. Thank you, Kanetta.